calling to try to understand how someone gets pronounced dead via telehealth screen. The patient was admitted to your ICU unit overnight. Is there a physician physically on that unit or in the building? So there was no physician actually in the ICU unit. They're on screen in another city. So the second question, the doctor that's on the screen, what state is she licensed? What I'm trying to figure out is, how does a patient come into your ICU unit? There's no doctors there. Patient decompensates and ultimately dies. And a physician pops on the screen and declares the patient dead over a telehealth screen. The family didn't even know that their child was in a telehealth ICU unit. What happens when the patient codes or needs to be intubated or has some type of intervention that has to happen? You call the ER and the ER physician comes up. What happens if the doctor gets lost when they're coming to the ICU? When the patient dies in the ICU, who pronounces them? The attending. So the doctor on the screen is the attending physician. The nurse holds up a camera to the patient, and the doctor on the screen observes and declares time of death. From another building. Who tells the family? The bedside nurse, not a doc. Does the doctor on screen ever talk to the family? Sometimes. I think the average person would not be okay with knowing that their loved one is in an ICU unit and they are never seen by a physical doctor. If they need some type of intervention, that they will have to page a doctor from somewhere in the building, and it's going to take time for that person to get to the ICU. It's generally understood that they are in critical care, meaning that seconds count.